Arteriosclerosis and atherosclerosis. Arteriosclerosis is an arterial disease manifested by a loss of elasticity and a hardening of vessel wall, more commonly known as hardening of the arteries. It is a normal part of the aging process and generally occurs uniformly throughout the arterial system. Atherosclerosis is the most common type of arteriosclerosis, manifested by the formation of atheromas, that is patchy lipoidal degeneration of the intima. Lesions or plaques form throughout the arterial wall, reducing the size of the vessel and limiting the flow of blood. Over time, atherosclerotic lesions can completely occlude the lumen by buildup of the plaque material and may contribute to thrombus formation. Pathophysiology and etiology. Etiology thought to be a reaction to injury. Endothelial cell injury causes increased platelet and monocyte aggregation to site of injury. Smooth muscle cells migrate and proliferate. Matrix of collagen and elastic fibers forms. Atherosclerotic lesions are two types: fatty streaks and fibrous plaques. Risk factors include hereditary, increasing age, male gender, cigarette smoking, hypertension, elevated blood cholesterol levels, diabetes mellitus, obesity, physical inactivity, and stress. Atherosclerotic cardiovascular disease afflicts 80% of the population over age 65 and is the most common condition of the arterial system, the elderly. Clinical manifestations may affect entire vascular system or one segment of the vasculature. Symptoms are based on the area affected: brain, cerebroarteriosclerosis, transient ischemic attack, TIA, stroke or cerebrovascular accident, CVA. Visual disturbances such as amaurosis fugax, amaurosis fugax, AMAUROSIS, amaurosis fugax, FUGAX, amaurosis fugax, which is described by patients as a shade over the portion of the eye. Heart, coronary artery disease, CAD, angina, myocardial infarction, MI, congestive heart failure, CHF, and gastrointestinal tract, aortic occlusive disease, aortic aneurysm, and mesenteric ischemia, abdominal pain, unintentional weight loss, lower back pain, kidneys, renal artery stenosis, renal insufficiency, poorly controlled hypertension, extremities, lower extremity arterial occlusive disease, intermittent claudication, that is pain in legs associated with exercise, rest pain, tissue loss with or without presence of infection or gangrene, embolic events. And third one is decreased or absent pulses, bruits. Diagnostic evaluation specific to body system affected. Arteriography of involved area may show stenosis and increased collateral circulation. CT scan, MRI or MRA, non-invasive testing of the vascular system, duplex studies, sequential Doppler studies, pulse volume resistance, angle bronchial index, ABI, ECG, echocardiogram, Holter monitoring, exercise stress testing, myocardial imaging and cardiac catheterization may be done to evaluate coronary artery disease. Management, medical management, modification of risk factors, prescriptive management, anticoagulants, antiplatelet therapy, lipid lowering agents, antihypertensives. Specific treatment for end organ dysfunction, brovascular insufficiency, angina, occlusive arterial disease. Vascular rehabilitation and exercise. Surgical management, endovascular procedures, percutaneous transluminal angioplasty, PTA, endovascular grafting and rotational atherectomy, and last one, laser angiography. Surgical revascularization of the affected vessels including embolectomy, thrombectomy, endarterectomy, ENDAR, TERECTOMY, endarterectomy, and bypass, use of graft, vein graft or prosthetic material to route the blood flow around the blocked area. Complications. Long-term complications of atherosclerosis are related to the specific body system affected. Brain, long and short-term disabilities associated with stroke. Heart, stable and unstable angina, myocardial infarction, MI, congestive heart failure. Aorta, ischemic bowel aneurysms, impotence, renal failure, nephrectomy. Lower extremities, intermittent claudication, non-healing ulcers, infections and gangrene, amputation. Thank you.